for irrigation and the type of solution to be used.
And you would just state that. So you're going to check the order. I'm going to.
And then you're going to administer pain medication 30 minutes before the procedure if necessary.
So I'm going to go ahead and give him his pain medication if he would like it, 30 minutes prior to that procedure.
Warm the irrigation solution to approximate body temperature.
Okay.
You're then going to identify the client using 2 client identifiers, explain the procedure to the client, provide privacy, and perform hand hygiene.
So hi, my name is Sue and I'm going to be changing your dressing today. Let me just check your name and date of birth. Can you tell me your name and date of birth? And he tells me and it matches my medical record. I'm going to provide privacy. I do my hand hygiene.
Place the client in a comfortable position that provides easy access to the wound and will allow the irrigation solution to flow freely from the wound with the assistance of gravity. Keep the client covered and expose only the wound.
So I'm just going to get you on your side so that we can go ahead and I'm not going to put it up too far so you guys can see, but maybe like this. And then I'm going to keep you covered as much as I can. Oh, and I need one. Okay, you want to keep reading?
Oh yeah. Position a waterproof pad to protect the bedding from any runoff. Position emesis basin at the bottom of the wound to collect irrigation runoff. Place a garbage or waterproof bag for soil dressings nearby. If necessary, perform hand hygiene. Apply clean gloves. You may also apply a gown and face shield and goggles if you suspect there may be any splashing.
I do my hand hygiene. I'm going to put on my non-sterile gloves.
Remove the soil dressing, noting the type of dressings that were on the wound. And observe the type and amount of drainage on the soil dressing, and also note the appearance of the wound. Do measurements.
Okay, so I'm going to go ahead and remove my Montgomery straps. I'm just going to take your dressing off. So I'm going to take a look, and I don't see any drainage on this outer dressing. I look at this, and I don't see any drainage on this gauze dressing. Start taking the packing out, and I take a look, and so if I see serous, or if I see sanguinous or serous sanguinous, purulent, I'm going to assess that. And so now I'm going to go ahead and take a look, and then, oh yeah, so I'm going to look and I see that I have slough on, say, 30%, and I see just a little bit of eschar, maybe 10%, and then the rest is granulation tissue and a little bit of bone. So this is a stage 4. I see I have some tunneling. I see I have some undermining. And so now I'm going to go ahead and I'm going to measure my wound. And so, because I have such a great memory, I'm just going to rattle it off. And I'm going to measure it in centimeters. Sometimes you will have on the back of your Q-tip, you might have a millimeters also. So I'm first going to assess the deepest depth of my wound. So I'm touching the bottom of the wound and I'm bringing my fingertip to that level. And so I'm going to say that is 2 centimeters deep. I'm going to say that it is 9.5 centimeters. The width is 7 centimeters. The deepest undermining 3 centimeters. My deepest tunneling is 4 centimeters. I don't notice that there is any odor. And I've assessed the bed of the wound. So now I can get rid of this. I would toss that away. I would throw that away.
So perform hand hygiene.
So I'm going to go ahead and take my gloves off.
Dispose of the soil dressings. And then you're going to chart your findings now. Size, type of tissue of the wound bed, drainage, odor, depth, tunneling, or undermining.
And if you just say it when you do it, you don't have to say it again there, okay?
Perform hand hygiene. And now you're going to set up a sterile field on a clean, dry surface. BBB pad, 35 mil syringe, 13 gauge needle, and a cotton swab. Fill
This-
sterile cup with sterile solution for irrigation.
You said cotton swab?
Yes. It says already on tray.
Yeah, I was going to say that's on the tray. My syringe and my Abby cannula is on there,
Oh,
okay? So I'm going to go ahead, and what's my first one?
That one away.
Away. My second one.
This side.
Third one is.
Pick up your glass.
Oh, thank you. Pick up your glass. Okay, I just know that side I didn't do a great job on, so I'm just going to leave it alone.
Is that okay? If
Mhm.
you have it like that, like you just know that you can't touch
I just
that.
know that this is my border now.
Okay.
Now you're going to open multi-pack of sterile 4x4s and pour sterile solution into the pack to moisten the gauze.
Okay, so I am going to contaminate my field, but I'm going to keep it away from where I'm going to be working. So I'm going to go ahead and open this, tuck it underneath so it doesn't flop back on itself. So now my 1 inch border is there, right? And so I'm going to check my solution, make sure it's not expired. I'm going to take it to the garbage and I'm going to lip it. And I'm going to moisten my gauze and I'm going to fill my fluid. And then I'm going to add what I need to add. So I need to add some of my ABT.
You're now going to apply sterile gloves.
Okay. So here is my stuff set up so I can put my gloves on here and my back is into my sterile field, right? So I am going to grab out my gloves. Now you saw when it went back on itself, I had not touched the inside of that flap, but had I done one of these and it gone back on itself, it would have contaminated. But since I was on my tabs like I should have been, I can open and I can manipulate it so it stays open, okay? I think my gloves are backwards. So I'm gonna grab my gloves. They should be the other way around, but I'll do it this way. So my first glove, I can grab the inside of the glove, right? And I can grab the cuff and I can get it up off. Watching the tips, so I'm gonna get it up so I'm not dangling it over stuff. And I'm gonna go ahead and slide it on. And I can move the cuff up as long as I'm touching the inside of the cuff. Okay? Second glove, I'm going to grab it and put my hand inside the cuff. But once I'm getting close to it, I'm going to get my thumb out of the way and I'm going to lift it up so that I'm not dangling it off the edge of my sterile packaging. My thumb is up. So now I can touch. And if you get your fingers in the wrong holes, don't worry, just get your glove on. Okay, so now I'm gonna go ahead and I don't need to worry about that. And now if I need this closer, what can I do? I can either use my foot or I can grab my sterile, slippery, and I can move it over. Okay.
Alright, so irrigate the wound. Attach the 19 gauge
Angio catheter.
angiocatheter to the 35 ml syringe and fill with sterile irrigation solution.
Okay.
Holding the catheter tip 2.5 centimeters 1 inch from the wound bed, gently irrigate the wound with a back and forth motion, moving from the superior aspect to the inferior aspect. Repeat the irrigation until the solution runs clear.
So my patient is kind of angled funny because I want you guys to be able to see, but I feel like in order to do this, my back is almost, but I would have my patient like this and I would be able to go this direction. But I'm just gonna go around here. And so I'm starting at the top.
When did you pour the solution in there? Was that before you put your sterile gloves on?
Yeah,
when you
because I can't
lift
touch it.
and then, okay.
Yeah.
Okay.
My hand covers the label. I lip it and make sure it's got
Yeah,
the
okay.
expiration date, that it is, you know, if it's new, I don't have to lip it, but if it's been open, I do. Okay, so I'm gonna start at the top and I'm not gonna touch my catheter tip to the wound, but I'm gonna go ahead and I'm noting how much is going in. Starting at the top, going down, and I'm noting how much I'm putting in and how much is going out. So I can come back over here and refill because I haven't contaminated anything yet. So now this is empty, and I know that I'm done here because it ran clear, right? So it ran clear, so I'm done with this. It is not contaminated. I can put it here if I want, whatever I want to do. It's not contaminated. I can put it right back in the middle of my sterile field, but getting it out of my way.
Pat the skin surrounding the wound edges dry with sterile gauze.
So make a little poof so that my hand isn't going to touch the wet and cause wicking. So I'm going to do this around the top edge. Toss. Other side. Okay. What's next?
Oh, I'm sorry. Wring out excess moisture from a piece of 4x4 gauze and unfold.
So this is sterile. I poured sterile gauze. I'm going to go ahead. I have sterile gloves. I'm going to get out the excess, and then I'm going to make something that I can pack. So I can kind of, so that I don't have this dragging and getting it contaminated, I'm going to just kind of roll it up in my hand and get this ready.
Using a sterile cotton swab or forceps, apply a single layer of gauze to the wound bed until all surfaces are in contact with the gauze. Be sure that all sinus tracts, including tunneling areas, are in contact with gauze.
And I don't want the gauze touching the outside of the wound. Sorry.
Oh, that's fine. You may be sure the gauze does not touch the surrounding skin.
Okay. So now I'm going to go ahead and start, and I'm going to, and you're going to see that when it's not wet, it does like to not stick as nicely. So I'm going to need another one. we're gonna do the best that we can with that without having it wet. Quit sticking to my Q-tip.
Can you touch it and like kind of push it down in, or is that like?
I can, because this is the outside of it. I'm done with my dressing now. So now I'm done. This is really considered contaminated, so I would toss it away.
And then apply dry gauze and cover the wound with a sterile ABD pad.
So now I can go ahead and cover it with a dry gauze. And there's no rhyme or reason. You can put it either way. I don't care.
And then secure the dressing with tape or just straps.
Okay, now I'm contaminated. Doesn't really matter. I've covered my dressing.
Dispose of gloves and supplies and perform hand hygiene.
So I'm going to go ahead and take my gloves off how I'm supposed to. Hand hygiene. I probably would put on another pair of gloves to get rid of this stuff, but you would go ahead, put your gloves on, get rid of this. Dump it, make sure that you're, how much out is how much you put in. I'm gonna get you in a more comfortable position. Let me just get this out of your way. Feeling okay? Great, okay.
And then on a label or piece of tape on the dressing, mark in ink, not marker, the date and time that the dressing was applied.
So mark it, date and time, my initials.
And then assist the client to a comfortable position, put side rails up, bed to lowest position, call it within reach, and assess their pain level. And then document and record the irrigation performed, type an amount of solution used, type an amount of dressing used, and how the patient tolerated the procedure, including the client's level of pain and comfort. And then report any brisk, bright red bleeding, sharp increase in pain, retention of irrigant, evidence of wound
Dehiscence or evisceration.
and signs of shock to the healthcare provider.
So you need to be able to do a laundry list for me. You need to be able to say, I'm going to document the irrigation performed, type in amount of solution used. And you can say, I put in 100 mils of 0.9 sodium chloride. My dressing was a 2 4x4 wet dressings, and then I put a 4x4 dry dressing over the top and an ABD. I have Montgomery straps, and then you can say patient tolerated without any pain, and I told the patient to report any brisk, bright red bleeding, sharp pain, retention of, well, I would say retention of irrigant, and then evidence of wound dehiscent or evisceration. What is wound dehiscent? It's where it breaks open. Evisceration is only abdominal wounds that it's talking about, really, and that's when your intestines or parts start coming out. It's usually intestines. Okay? And then report any signs of shock to your healthcare provider.
So in the checkoff, like for number 31, you have to say you report and say all of those.
You'll do it.
So when you do the irrigate, sorry, can you?
No, you go first.
You say, we're supposed to say how much is measured out, so how do we measure how much came out then? Do we dump it in
And it does have a rudimentary.
on the inside?
Mm-hmm.
Or could you just say like if you filled the syringe like 2 times, so like, or like if you filled it once,
Yes.
35 milliliters.
35, but I want to know how much then came out too, right?
Oh, okay.
So if nothing came out, you irrigated, nothing came out, you would have to report that.
So we can kind of make up a number then, like that came out.
Yeah, sure, that sounds fine.
So you don't actually have us like irrigate it with, no.
No, there's going to be no water used.
Okay.
I just have a quick question. So when you're moistening the 4x4s and then filling up your cup, do you need, so your 4x4s are technically out of your sterile field, correct?
But they are sterile on the inside.
Yeah, okay, so you don't have to, do you have to lip it? Do you have to lip the bottle
No,
twice?
the only reason you lip it the one time is you're clearing off anything that was on the lip.
Okay.
So you wouldn't have to lip it twice,
Okay.
even if you were putting 2 solutions on your sterile field. So here you would go ahead and give it, and here. So
Okay.
you've washed away anything that was on that lip potentially.
And then when you were packing too, when you said you did touch it, you can do that, and that's still sterile?
Because what you've done so far, so when you're packing the dressing, you're essentially done. And so if you touch to get your dressing in there better, it's not like you're gonna go in and do something more with your wound, because it's
Right.
clean now. It's its own.
Then it's okay to like
Dirty.
easily contaminate.
So you
everything
could,
else.
yes, you could. At that point, I wouldn't get excited, yes.
Okay.
And it is so hard to get that gauze to stick in there when it's dry. Usually it's not so hard when you're putting in